First of all, thank you for speaking with us. We just want to get from the CARPA director what's going on with CARPA. If you could tell us something to something what we're doing this year for Caribbean countries and things like that. Tell us something. Comments.
Thank you. I'm very pleased to be here in Guyana at the start of the CARPA 62nd Annual Health Conference. The theme of it is climate change, the environment and human health. And the issues of environment very relevant to Guyana. So we're really pleased to be here. This year in Guyana we'll be doing a lot of different activities. The ongoing monitoring of disease and supporting you with lab testing. We'll be working on this tourism and health program, working with support minister with her tobacco legislation. Those are some of the areas. We have a 6-point policy package that the CARICOM has agreed to help tackle the food environments that children are getting fat on. So we're looking at mandatory nutritional labeling to empower consumers with information. We're looking at reducing the amount of advertising of junk food to children, seeing how we can reduce fat, salt and sugar, more fruits and vegetables. Now Guyana could be the breadbasket of the Caribbean, so maybe there are ways in which the fruits and vegetables here can supply the rest of the Caribbean. Those are some of the areas we're working with you on training to build up the capacity of your own national to monitor and respond to health problems. The conference later this week is going to be a whole feast of papers to help improve health policy making, to educate and update the doctors and nurses on some of the more current discoveries. And there'll be news there for people as well about people who have certain health conditions, what to do. Another exciting thing we have is we have a climate change and health panel, expert panel, with experts from the region and international experts from NIH, from US CDC and so on. So that's coming together and we'll be meeting tomorrow to come out with a report on what's the roadmap for us in the Caribbean for climate and health. Guyana is amazing in that you live in Georgetown with what many Caribbean countries will in future have to live with, being below sea level. And you will have experience to share with the rest of us in CARICOM about how you do it and how you live with it. Of course, you have to maintain the infrastructure, and sometimes that has been a challenge and you get flooded out. But those are some of the things that we have in store.
So, how has regional integration been in connecting Caribbean countries and regional countries in terms of health and supporting one another from CARPA's perspective?
Well, the Caribbean has a long history of good cooperation in health. Sometimes when you're hearing bad things about how CARICOM this and that, the health part, for years has been working. We eliminated measles in this region, first in the world to do that, 20-something years ago. We elevated the problem of HIV and got a big response. Now we're talking about ending the fight. And that was by working together through CARPA, with PAHO and so on, and CARICOM. And most recently, the whole issue of NCDs, the heart disease, stroke, that was taken to the global level through concerted effort. The region has just agreed to Caribbean regulatory system for pharmaceuticals that will register on behalf of everyone to improve the regulatory capacity in the region. In CARPA itself, the shared service that we offer in laboratories, that's folks working together. I would say the cooperation in health is stronger than it's ever been. And we have challenges, but we also have a clear idea where we need to go and how that will help the whole community.
So, like every other thing, there's a weakness. What's the main weak point for CARPA? As in a disease that is burdening the Caribbean or any weak?
Well, the main weak points and challenges, the sheer size of the health problems we face, with problems with obesity, with diabetes, and then some of these infectious problems, like we saw the Zika come through last year, because we have Aedes aegypti mosquitoes in our homes. One of CARPA's biggest challenges or weaknesses is we don't have sufficient investment to deliver the programs we're supposed to deliver. So we've been advocating with our governments. We have been getting good support from partners. We need more support to be able to deliver the prevention and control programs.